Hello, I'm Dr. Gerald Chodak, and this is prostatevideos.com. In this video, I want to talk about men who are undergoing a prostate biopsy, because there is a growing recognition that men are at added risk for getting serious complications. Even some men have died from this procedure. And so if you're about to undergo a procedure, there are certain things you should be aware of. Most doctors are giving an enema prior to the procedure and giving patients an antibiotic with a drug called ciprofloxacin. The problem is that many times the patients have resistant bacteria in their rectum, and so that antibiotic doesn't do a good enough job. Who might that be? Well, people that work in the healthcare industry, people who have traveled out of the country, maybe visited a third world country, maybe you've received an antibiotic in the recent few weeks prior to the procedure, or maybe even had an infection that had to be treated. Also, diabetics are at higher risk. And so, if you're in that category, you might want to discuss with your doctor ways to minimize the chance of getting an infection. One thing that has shown a benefit in some studies is to do a swab of the rectum and send it for a culture to try and determine what kind of bacteria are there and whether or not they are sensitive or resistant to the antibiotic that the doctor will normally prescribe. If a resistant bacteria is identified, then the doctor can switch to a targeted antibiotic that will more effectively prevent a serious infection from occurring. So being aware of this added concern is something that you can do to help minimize your risk. It's also important to recognize that too many biopsies are being done. A slight rise in the PSA may not warrant an immediate biopsy. Instead, the PSA can be repeated because oftentimes the PSA will go back down with no intervening treatment, and it doesn't mean a patient has prostate cancer. So in the end, hopefully you'll find this information helpful as a way to reduce or minimize your risk from undergoing a prostate biopsy. Thank you for watching.